East African time. Thank you, Cressida. Just for logistics, we will be able to, this webinar is going to be recorded, and I hope that's okay with everyone. We will have two discussants that will be joining us, and the two are already here with us. We were expecting quite a big number of people to attend, and as they're looking in, we will accept them as they come. Please feel free to listen in, and if you have any questions or any issues you may want to raise, feel free to use the chat box or the question and answer app, and we'll be able to respond to you as fast as possible. So I want to thank everybody for joining in this webinar today. Good morning, everybody. Good afternoon and good evening from wherever you're logging in. We are glad to have you attend this very important webinar, where we will be discussing family reunification and reintegration of survivors of human trafficking. And also, we will specifically also look at the aspect of avoiding re-trafficking. So today, our major discussant will be Mr. Rogers Kasirye, the Executive Director of Uganda Youth Development Link. And later we will be joined by Johanna. Johanna is the GIZ advisor for the East African, for the BMM region in Kenya and Ethiopia. And she will be joining us as a key discussant on key papers that they have written and research that they have done in regards to re-trafficking and migration. So you're very much welcome, our discussant and panelists. I want to thank the UYDEL team for organizing this very wonderful webinar. I want to appreciate WFAD, World Federation Against Drugs, for supporting the UYDEL team put together this webinar. And also I want to appreciate ECPAT France for allowing us to share some of the key findings that we have seen in the East African region, but also in Nigeria. I think right now, I'm going to invite our key discussant, Mr. Rogers Kasirye. He will be sharing with us some of the reflective consultations they've had on human trafficking in Nigeria and in the East African region that have to do with sexual exploitation, human trafficking, substance abuse, and crime among among young people. But also we will look at his vast experience in this area for the last 15, I think it should be around 28 years. Though he puts 15 here, but I think it's about 28 years of experience in this area. So Mr. Kasirye, you're most welcome. Please go ahead and take us through your presentation. I'll stop sharing my slide now, and then we can have you come in. Cressida, kindly support with sharing Mr. Kasirye's slide.
Oh, thank you so much, Anna, for that great introduction. But I'm also grateful for other people whom we are going to share with this, especially Johanna, who said that this area is of interest to many of us. I'm grateful to WFAD, but also to ECPAT France and ECPAT Luxembourg, who have continuously supported the activities related to reunification. And as you may be aware, most of our efforts have been largely in prevention, which is very good. Now law enforcement also is actively being supported. But again, we are beginning to see young people and women and also men being, coming back after experiencing human trafficking. So I'm going to request Cressida. Cressida, please, if you could move to the second, if you could share my presentation. If you could go to the second.
Yes, Mr. Kasirye is putting.
Can you see it? Can you see the second one?
first and then the second. You have gone to the third. Okay. My interest for sharing this, Crusader, can you go to the one before this? Was my recent participation in the UN stakeholders engagement. Thanks to UNODC, they have been organizing stakeholders, particularly the civil society and many actors who are involved in the area of crime, area of human trafficking. And I had an opportunity, but even in the discussions, when you hear, it's more about law enforcement, it's more about prevention. But my interest is that what about the women and the young people who are coming back? How do we help them and they are not re-trafficked? And as you are aware, civil society is an essential partner in delivering the UN to the needy people and even the protocol. But also you are aware of the Sustainable Development Goal, particularly Article 16.2, where we have to target organized crime, particularly looking at sex exploitation, trafficking, and all forms of violence. My other interest that I had an opportunity to visit East African states from Ethiopia, went to Tanzania, Malawi, Zambia, Kenya, trying to understand what our people are doing and then document these good practices, which we'll be happy to share with you. Actually, Crusader, I should be able to share my presentation in the Zoom so that people are able to see it. You have moved a little bit fast here. Can we go to the, okay. But importantly, African governments are not doing well in terms of protecting migrant workers. They are getting a lot of money, surprisingly, but our work has remained minimal. Of course, there are good examples and good case studies like in Nigeria and others, as we'll see. But the intervention and the support from government is minimal, as we'll go on to see. Next one, please. Next, Crusader. The blue ribbon. We have to do it here. Crusader.
Can you see that I changed the slides?
No problem, but go to the third one. This is the fourth.
Oh, okay, this one.
The blue heart. As you are aware, many of you have seen this blue heart, but the blue heart represents the sadness of those who have been trafficked. It reminds us of the cold-heartedness of those who buy and sell fellow human beings. They are so cold-hearted that even now they have started removing their organs. Next. In discussing this, it is also important that we are aware of the US TIP report, Trafficking in Persons Report 2022. Anthony Bögel, when he was sharing, he observed that everyone should be free, that human trafficking is a force, fraud, and coercion. It violates most of their basic rights and diminishing and destroying our communities and sense of security and the global economy. He says that everyone should be free. And this is where I'm drawing my inspiration, that why are people holding on to others? Why are people going to this extent? Next. And as you are aware, UNODC is the guardian of the United Nations Convention on Transorganization Crime, and where the three protocols on human trafficking, on illegal smuggling of immigrants, crime, drug abuse, and many of these fall. So whoever talks about reintegration, reunification, and support, it's important that you get used to some of these protocols and the convention so that you are able to understand the global thinking and what governments are doing. Next. Next, please, Crusader. Let's look at human trafficking globally. In 2018, UN told us that 50,000 human trafficking victims were detected in 148 countries. I tried to capture the data, the present data, and it was not easy to find the data But they are telling us that 50% of the 50,000 victims were trafficked for sex exploitation. And 38% were exploited for labor. You as a person who is planning to do reunification and reintegration, look here, they are telling you that of the victims of trafficking, 50% of them will go through sex exploitation. They are telling 38% will go through forced labor. And the majority of these are victims, are female victims who are primary targets. In other words, you are going to receive many women who have been victims of this. And they're telling us that women make up 46%, but they're also saying 19% of these are girl victims. But data in Africa is still scanty, and this makes it a little bit difficult. As we will see about to return, the victims, how they are returning from abroad, or those who have been trafficked domestically, how do we get in touch? How do we come to know? How do we come to support them? Next, please. Global UNODC also continue to share with us and tell us that 1 in every 3 victims is a child. And the share of children among detected trafficking victims has tripled, has increased. And at the destination and while in transit, victims come face to face with untold exploitation and bondage. That's why I'm going to discuss reintegration, reunification, integration. And that's what do we do so that we are able to not our young people to be re-trafficked. And thanks to Johanna who accepted to share also our experience about this. Next, please. In Africa, I was privileged to look at the report from Nigeria in terms of African human trafficking and having a snapshot of Nigeria. Nigeria is one of the countries which is well organized, but also which is doing a lot of intervention to address trafficking. Actually, they have a robust program. And it is, you know, they keep telling you that of the trafficking victims, 61% of them happen internally, which is almost similar in Eastern Africa. Most of the trafficking, human trafficking, we happening within the countries, and sometimes it's not detected. But a lot of attention is paid for external. But they're telling you that 61% of human trafficking in Nigeria happens internally. It's only 39%, which is across border, But they're also telling us that girls and young women from Edo State, Nigeria, which is Benin City and other areas, are trafficked to Middle East, Asia, Paris, and other European cities, which is also a similar situation in East Africa. Our people go to Europe, go to West Africa, go to Asia, and here they go through desert and Mediterranean. I had a chance to meet young people who have been trafficked, and they had to go through the desert, to go through Tripoli, go through other countries, go through Libya, and this is very sudden. Next, please. I'm trying to show you what we are seeing in my organization here in terms of young people. And as we have shared, most of the trafficking is really inside. But many of them are targeted traffic to go to work in bars, are targeted to work in homes as maids. But also we see a lot of cross-border migration among the young people we serve. Next, please. Yeah, we are trying to show you the graphs and how the numbers we are moving. We had more numbers. After the numbers have gone up, if you can look at my bar graph, the top bar line graph shows you that the numbers are going up. The numbers are going up. Next, please. Next, please. Let's look at some of the efforts in Uganda. We have seen an increased investigation and prosecution of more trafficking, thanks to the Ministry of Justice, Internal Affairs, and the Human Trafficking Institute, which are helping a lot, convicting more traffickers. We had to develop a robust standardized operating procedure for law enforcement agencies, thanks to the National Network on Trafficking, UCATIP, which has worked with others to develop a national referral guidelines on management of trafficking. But our government did not meet the minimum standards. Access to adequate services in Uganda is a big challenge, but lack of shelter, and this is what the NATP report is reporting, and the lack of shelter in the country to adequately protect trafficking victims. Next, please. I'm giving you all this background to help you to see, before even I discuss what I've seen in the region in terms of good practices. However, the United Nations Office on Drug and Crime has produced general books about some of the, has produced a compendium and suggests some good practices. I captured 4 of these. The interplay between the private sector and the trafficking person. They are recommending activities around the interplay between the private sector and the trafficking person. They are also recommending engaging actors with other human trafficking and supply chain. Engage actors, civil society, government, the private sector, engage them. They're also talking about finance, money, availability of money, the role of financial sector in helping to curb the problem. But they're also talking about a private-public prostitution partnership and the technology sector, which must be addressed. And they want to maximize this. I want to recommend that in your free time, you look at this, and this may be information. Next, please. Now, in Nigeria, there is a very big project supported by ECPAT France. And it's a project called Don't Pay With Your Life project. There are interventions, the organization involved the Girl Power Initiative, which I was able to visit, the Uromi Justice Development Peace and Caritas Initiative in Uromi, and also IFLA Nigeria, which has done a research. All these were able to receive returnees from who had been trafficked outside their countries to Europe, to other countries in West Africa. And we were looking at what we are doing to see actually what we are doing, thanks to ECPAT France and ECPAT Roosevelt, which funded them. Next, please. So we were able to capture good practices on family reunification, integration, which we observe that reintegration, reunification is a long, complex road. Nobody should tell you that it's easy to reintegrate these big survivors or victims. Survivors is a long, reintegration is a long and complex road. Next. And one of the good practice which we noticed, which I'm going to capture in a summary, because I suggest that consider you share my presentation to the Zoom link so that people are able to download, was to do with tracing and identification of the family of survivors. There are survivors who want to go back to their family. Depending on the circumstances, they were recruited, coerced, and forced, and ended up in human trafficking scenario. So you are supposed to do a good tracing and identification. Plan, assess, identify the needs, identify the services, and assist the survivor. You together, the social worker, the agents, you must do a plan. And as you are tracing and identifying, you are going to take note that these survivors, the victims, have multiple needs. And you need to be available with the family for a very long time, because it's not a one-day event like we saw, but we were informed by Girl Power Initiative, by Uromi, by what we have seen here, that a social worker must be available so that you are able to address the needs. And also you'll be surprised that some of the young people, the women who have been trafficked abroad, will not want to go back to their family. Some want to do self-integration, some want to do independent living. You also be able to see that some other women prefer to live away from home. Some had children and want to stay with their children. So you as an agency, you need to give survivors time to make a decision. By then, don't force them to go back to their families. Leave them to make a decision. Where do you want to live? And that is a time, and that is a process. It's a process which you must take the young woman, the girls, the children, the men to go through. But also what we have noticed that in identification and tracing, avoid multiple interviews with the survivors. Do not ask them too many things. Do not ask them too many things, because multiple interviews can lead to overloading and habituation. But also we have noticed that where multiple interviews by government, multiple interviews by policemen, by social workers, by security guards, by everybody, leads to confusion and overwhelming, and survivors can end up, lying to you. So do a good tracing and identification process, be able to do a plan. Next, please. Counseling, so that the family can accept the return. so that the young woman is able to adjust. You need to do counseling to support families to learn how to adjust and adapt amidst the crisis of human trafficking, linking the family to the social and the economic sources. Counseling is key. Counseling is not going to be done anyhow by anybody. Actually, social workers must be trained because they are going to do psychological help. They are going to provide emotional support to address the risks. They are going to address issues of suicide and depression and the trauma. People must be trained properly. In other words, so that people are not jumping on the young woman who is undergoing the adjustment, who is going to be assisted to integrate with the family. Counseling, but training was very important. Next, please. We also saw that survivors may present medical issue. Actually, at Girls Power Initiative in Benin City, and also what I saw in Umi, they say that when these survivors, victims come to your agency, whether they have been trafficked internally or trafficked abroad, they are going to present medical issues. And it is important upon arrival and even other subsequent follow-up visits to assist them to access medical facilities. Some of them have had skin problems. Today, we are faced with organ removal. A victim comes back, he has had, some of the organs removed. We are aware of victims or survivors who have been brought back, thanks to our, trafficking office here in Uganda. A victim who had been trafficked, she came back when she had been infected with HIV/AIDS. She was pregnant. And where do you begin? That, in other words, if you are going to do family reunification and integration, you must do a thorough preparation. A thorough preparation because the victims will present medical issues. I've listed a few, but the others which our colleagues will be able to share. Next, we also saw another good practice which we saw was to do with law enforcement. Next, please. Next, legal support for survivors. Survivors, it may be necessary, as many of them will face violence. Violence from the traffickers, violence from the family, violence from the whether psychological, physical, all this need to be supported. Sometimes others get victimization. Others face gender-based challenges. We sold our property to go and make money. You didn't make money. You have come back. It may cause acrimony. It is not an easy thing. And the victims and the survivors need support. Their property may have been grabbed. Pressure to pay perpetrators, unpaid, and those in bondage. So you must generate information because this information may be helpful to combat the vice in the future, but also to support the legal prosecution and conviction and give evidence in the courts. So we recommend that it's not a matter of even integrating, but can you compile, can you get together that information? After what we saw at Uromi at JDPCI, they had even hired 2 lawyers who were busy supporting, because some of the victims there we saw in Nigeria, in Benin City and also Uromi, many were facing, violence. People wanted their money back. There was a lot of acrimony, and the lawyers were there to support and even go to court and provide evidence, which was very important in prosecution. Thanks to NATIP in Nigeria, which has a very strong, arm which tracks and arrests some of these traffickers. Next, please. Now, survivor involvement in the family integration. Everybody now is beginning to see that for you to do a successful integration and family reunification, meaningful engagement of survivor is important. But first of all, listen to them, learn from them. But also they are saying survivors can mentor others. We social workers, sometimes we assume we know everything, we can do everything, but they are recommending that, can you engage, can you involve the former survivors under rehabilitation, those who have adjusted well, train them, because some of them can even train their colleagues. Can you establish forums? We saw forums had been established. Thanks to the advancement at GPI in Nigeria and Benin City, but also Uromi, survivors had forums. Survivors had the platform to share, which gave opportunity for the NGOs to listen and to tap on their experience, to support, to train, and in change. But also they can undertake activities for NGOs. Instead of NGOs doing everything, can you engage survivors? Next, please. psychosocial support activities. These are separate. But as you will see, this help us to identify psychological and social needs. And we saw that you need to institute case management plans for each and every client or survivor you are addressing. And this must be detailed enough. And this is what we saw, and this is recommended. Once you have this, then you'll be able to plan and manage and be able to assist the survivor to integrate. But also, you must also undertake sessions. We saw sessions of resilience being conducted, gratitude, teaching young people, those who have been trafficked, to be gratitude, peer-to-peer led activities, trauma sessions, sessions on suicide, and all these were helpful. Sessions on drug abuse, sessions on crime, stigma, which was a very big issue, by the way. If a young girl has gone abroad, she comes back, she has been forced, or she has come on her own. Stigma is a major issue which you must address. And if she didn't make money, it is a very big challenge. Actually, we are able to see young people, women who had gone, who had left their children, and the children had become street children. You see, you are helping a survivor to integrate with the family. She tells you she had children. The children now have become street children. You see, the work goes beyond looking at the survivor, but the issues which are presented. That's why we recommend the case management. In other words, you, a single NGO, you cannot address the problem. You need the support of others, other actors, whether public or private. And this is a very good example. Next, please. I consider kindly share my presentation. Now, we've looked at tracing. We've looked at counseling. We have also looked at medical and legal support, which are very key areas in terms of the integration. Now comes economic empowerment. It is very critical once you have achieved the psychological benefit. But also, what was the cause of this young woman to be trafficked? Was it poverty? What was it? Through peer influence? You need to address this. But many of them will be able to move largely because of unemployment, because of lack of money, because they are having challenges in survival. So economic empowerment, orienting them business services, accessing them to capital, engaging them in groups and schemes. Now, why am I recommending this? We saw this happening in Uganda. We saw this happen in Nigeria. Organizing young people, setting them business enterprises. And many of them were doing very well and were doing business. And after they had settled down. And this is what makes a difference, because we have been learning. Previously, we have been trying this and this, but now ECPAT France and all these actors are helping us to reshape our work. Thanks to UNODC, thanks to others who are helping us. I know GIZ has been doing a lot, and that's Johanna will be sharing, because we need to build capacity of our workers, our service provider, in order to help young people settle. Next, please. Vocational skill also was identified in terms of employable skills and knowledge. Vocational skills which can create self-employment, but also vocational skills which can help young people to be employed. And diversification of skills. What has come up from what we saw in Nigeria and also some organizations in Uganda, young people are not taught only one skill. They are taught to be tailors, they are taught catering and bakery, but they're also teaching them other skills which can enable them to earn income. Even those who are doing business, like what we saw in Nigeria, in Uromi and Benin City, those who are assisted to start business, we are doing multiple activities to help them earn money. And once the young women get money or get trained, I tell you, they'll be able to sit and settle down. Next, please. I'm about to finish. Yeah, we saw multiple skills and multiple sources of income. You can see they were tailoring, they had fridges, they were selling shoes, they were selling hair and oils. Those who were involved in hairdressing, they were combining many activities. And that's what we are recommending. If we want young people to settle down and not to be in traffic, teach young people to have multiple skills, teach young people to have multiple sources of income for survivors. Next, please. Support families, identify and support families. What was interesting is that much as the NGOs are supporting survivors and victims who have returned, but also they had an element of supporting families which were vulnerable. and whose young people were likely to be attracted for employment in the city or to be moved. Actually, they were giving a lot of grants to families so that the families are able to support these girls. They are supporting girls to stay in schools, supporting girls in the communities, so that these girls don't become attracted to trafficking. Because traffickers will take advantage of our vulnerability. That's why you must work with the families, not only families of survivors, but also families in the community where numbers begin to emerge. Next, please. Social work supervision, training, monitoring is very, very important. It's very important. Train the social workers in all these areas we are talking about. How do you do an effective tracing and resettlement? How do you do psychosocial support? How do you do counseling? How do you get involved in medical issues, legal support, economic empowerment? Sometimes you have to bring in other people, not necessarily social workers, but also other people who are involved. Next, please. In other words, like I said, long-term reintegration support is very key. NGOs must be part of partnerships and networks. We are very proud of the networks we saw in Nigeria, but also the network we see in Uganda, thanks to our chair, Dr. Annette, and the UCATIP support we see here. You know, NGOs need to work together. You alone, the work will be too much and insurmountable. We encourage networking, sharing, but giving support, but also mobilizing resources together. That is very, very helpful. Next, please. And again, much as you can do reunification, integration, never forget to do community awareness, which is very key in prevention. Never, because we want a community to take over these issues, because how far can NGO go? I want to tell you that funding for human trafficking, for young people who are in sex exploitation is going down. That's why we must create awareness, educate the community about the dangers of human trafficking. We must do that, and that should be part of us, because we want to promote ownership of intervention and in turn promote community responsibility to watch against perpetrators of what? Of human trafficking. Next, please. So we need to do a holistic intervention, and the intervention are holistic. They have an element of economics, business, enterprises. They have an economic of psychosocial support. They have an element of health, an element of law enforcement. All this must be done in a holistic way, because reunification and integration is a long-term goal. And many needs are going to show up, but it's easier to work together and we deal with the problem. Next, please. Anna, it appears I'm done, and I'm very grateful to the people who have turned up to listen. But also, as you said, we need to give Johanna also to be able to share. And thank you so much. We'll be happy to hear from other people. Thank you very much. Thank you for listening to me and giving me this opportunity. The materials will be shared and available. Thank you very much. Anna, over to you.
Yes, thank you, Mr. Kasirye, for this wonderful presentation and for the rich information you have shared with us in regard to family reunification and reintegration and how we can avoid re-trafficking of survivors of human trafficking. So right now, before I can call on our next panelist discussant, I would want to remind all the participants on this webinar that we are currently having a webinar on family reunification and reintegration of survivors of human trafficking and how we can avoid re-trafficking. And I want to thank you all for logging in, and I want to thank Mr. Kasirye for sharing his rich experience from Uganda, from Nigeria, but also from across the globe on how we can avoid re-trafficking of survivors of human trafficking. So right now, before I can call in our next discussant, Johanna, I hope you're getting ready. I would like to urge all the participants to kindly get into the chat box and share with us your name, your organization, and the country that you're logging in from. And also, if you have any questions or any issues that you may want to raise, feel free to use the chat box and the question and answer box, and we will be able to get back to you. So right now, allow me to introduce Johanna. Johanna is an advisor under the GIZ on the BMM Better Migration project, Better Migration Management Project. And she will be sharing with us some interesting data on re-trafficking, migration, and also the trends that she has seen and the paper that she has written on re-trafficking of victims of human trafficking or survivors of human trafficking. Johanna, you're most welcome. I'm going to share my screen now. Feel free to let me know when you need the next slide. Johanna, you're most welcome. You can take it on from here. Thank you.
Thank you, Anna. Okay, I hope everyone can hear me well. Anna,
Yes,
can
go
you
ahead.
hear me well?
Yes, we can hear you.
Great. Okay, perfect. Yeah, so thank you everyone for joining us today. I was really delighted to see the topic of this webinar because just last year I actually had written in a private capacity, so not as part of my work with GIZ and the Better Migration Management Program, a paper on the problem of re-trafficking. And I really see this as a bit of a blind spot for the entire anti-trafficking movement. That long-term solutions for victims of trafficking is something where we are not quite closing the loop, but where we actually encourage a vicious circle of people being trafficked and re-trafficked again. And I did some research on that, which also was published and is available online on the Mixed Migration Center and UNHCR Protection Conference website. So I can probably share the link afterwards so you can read the full paper there, but I will share with you some insights of this today. Can we move to the next slide, please? Okay, so the research in a nutshell finds that reintegration really is a default long-term solution for victims of trafficking. Other options, such as resettling in a different community or a different country, are rarely looked at when talking about long-term solutions for victims of trafficking. And for many victims of trafficking, reintegration simply does not work in the long term. And these failed attempts of reintegrating victims of human trafficking can lead to human trafficking becoming a circular problem. And the scale of this is both under-researched and also underappreciated. The research that I did focused on Ethiopia, Kenya, and Somaliland. So Uganda, unfortunately, was not part of the research, but since it does comprise 3 countries of the region, I would assume that the findings will be to some extent relevant there as well. I've based this research on analyzing the national referral mechanisms for victims of trafficking, and I also interviewed some local NGOs and looked at the relevant literature, of course. And then under the BMM program, we also did some research together with Freedom Collaborative, where we did a regional routes mapping of trafficking routes. And there we also had some findings on re-trafficking, which I will share with you as well. Next slide, please. So long-term solutions, as I mentioned, mostly equals reintegration. In most of the national referral mechanisms, reintegration is discussed as the only real option. And I think what Watchers had said earlier, giving trafficking survivors a choice really is an important one here. And for them to be able to be empowered again and to make a choice about their own life and where they want to be, the choice shouldn't only be, do you want to reintegrate now or in 2 weeks? But there should be some alternatives and some different options available to them. We also found that follow-ups and monitoring of reintegrated cases is quite limited. In one of the NRMs, there actually was a legal requirement that it cannot be longer than 6 months. And most of the interviewees of the CSO said that they follow up between 3 and 6 months. And there is some research on the prospects of trafficking survivors in the Asian context. It's called the Butterfly Research Project. It is a longitudinal study where they followed reintegrated victims for a total of 10 years. And they actually found, sorry, I think you skipped ahead a few slides. Thank you. One before? Yeah, thank you. And in this Asian context, they actually found that most trafficking survivors start to struggle after reintegration about 2 or 3 years after successful reintegration. So in the case file, it will read that reintegration was successful because the first few months, everything looked good. But then a few years down the line, health problems will come up, unemployment will come up. For some of them, suicide rates increased. So there are some really serious problems also of re-trafficking and further exploitation, including sexual exploitation, further down the line a few years after reintegration. So we really need to talk about very concrete timelines here when we say long-term, because 6 months simply will not cut it. But as mentioned, there is very limited data on whether reintegration works in the long term if one defines the long term as several years down the line, or even as the lifetime of the trafficking survivor. And in my research, I have found that this is mostly due to 3 factors that reintegration is challenging for many victims of trafficking. Under the structural factors, one of the main points is that the same challenges that led to them being trafficked in the first place will usually still be in place when they return home. On top of that, usually there is this lack of economic opportunities. Most of the interviewees that I talked with said that they give some training and some grants for small business opportunities so that these people become entrepreneurs and self-employed. But actually this isn't because all of these are amazing entrepreneurs and they will be very successful business people, because they're also so very sort of prone to this themselves, but simply because for many of them there is so much stigma coming with having been trafficked that they will not be employed by other employers. So self-employment for many of them is not the best, but the only option. And among the structural factors, quite often also the initial trafficker who initiated the first contact towards being trafficked will still be in the community, and this is often ignored in the reintegration process. Next slide, please. On top of that, there are certain personal factors, and I think Rogers has already pointed this out very nicely, so I will really just skim through this. The experience of being trafficked quite often comes with gross human rights violations and exploitation that leads to severe trauma. So these people really are heavily traumatized in many cases. And this really makes it more challenging for them to then be reintegrated into the same environment that they had left already beforehand. Next slide, please. Next slide, please. Thank you. The third factor are community and household factors. And this also builds on something that Rogers had mentioned earlier. There is a lot of stigma that comes with being trafficked. So often these people are discriminated against and excluded on a social level. This is then something that also ties to their problem of being employed and needing to be self-employed because it is the only option, even in an environment where maybe it isn't the most promising business environment. On top of that, victims of trafficking often face household debts. Now you skip to the next slide. Please move back to the last one. So quite often they also do struggle with household debts, and that is quite often related to, Anna, I'm still on the one slide, could you, thank you. So often that is related to their migration experience. So often they went into debt themselves for being able to migrate, but also quite often they have gotten loans and got money from their family and from their household members. And then they return without actually having any returns to show for this. So there is a lot of economic pressure for them, but also pressure that then translates into social pressure and stigma for not actually having any financial gains to show their migration attempt that then led to trafficking. Anna, I can no longer see the presentation. Could you get it back on, please? Anna?
It seems that we lost the connection with Anna.
Okay, that's a shame.
I'm sure she's
somebody
coming
share-
back.
Yeah. Okay, then let me just summarize. So there were these three factors. The structural factors of quite often the people then experiencing the exact same circumstances that have led to them being trafficked in the first place, that often in reintegration processes aren't sufficiently addressed, including the problem that the trafficker still lives in this community and quite often in the same household. For child trafficking, quite often it were the parents who, sometimes with the best intentions, sometimes not with the best intentions, have sent their children to a situation like that. In these cases, reintegration can be very difficult and very risky. Then we also had the personal factors related to trauma and also the community and household factors. And I found one of the interviewees during my research summarized the problem very nicely, and I have actually used this quote here. There simply are no systematic safeguards against re-trafficking once a trafficking survivor is reintegrated. And that is something that I think would be very useful to look at more systematically when reintegrating, and also something that hints to the necessity of actually coming up with alternatives to reintegration for those cases where it really doesn't work. So to summarize, there are very few statistics on re-trafficking, but there are some estimates that show that this is a feasible problem. I have asked the interviewees from the countries that I interviewed, so Kenya, Ethiopia, and Somaliland, to give an estimate of how many of their clients that they worked with had been trafficked before. And I had anything in between 5% to 30% of their clients who had been re-trafficked before. There also seems to be an intergenerational dimension, because many of the child victims of trafficking actually are the children of people who have also been trafficked. So a risk towards being trafficked is also something that seems to be passed on. This might be through secondary trauma or other mechanisms at play here. This would need to receive further attention in research. There also is a general lack of awareness of re-trafficking being an overall problem. And as a clear sort of implication of this, I would say that long-term solutions really also should be seen from a prevention perspective. So one of the best things we can do to prevent human trafficking is to make sure that those people who we do reintegrate are reintegrated well and in a sustainable way in the long term. And the long term not meaning 6 months, but for the rest of their life. Next slide, please. And I think this will be the last slide. Yes, so this is the research that I have referred to earlier that actually was done by BMM and is funded by the EU and the German federal government and has been implemented through Freedom Collaborative with the regional CSOs, many of whom I've seen actually are here today. So this really is based on the data that you guys have provided for the analysis to Freedom Collaborative. It is based on 2021 data from the entire Horn of Africa region. And here we have asked the CSOs out of the clients that are victims of trafficking. So we looked at both vulnerable migrants and victims of trafficking, but here it's only the victims of trafficking. How many do you know, for how many has these clients been trafficked before? And I actually found this very interesting because here we have almost 10% of the clients indicating that they have been trafficked before. So we're at 9.4% here. That is a feasible number, but sadly that is actually very much in line with what we also see internationally. So this is a feasible problem within the Horn of Africa context as well. And for the first time, we actually do have some concrete numbers here. So thank you again to everyone who has participated in this research. We actually, for the first time, have some useful numbers here that show the scale of this problem. And with that, I'm at the end of my presentation and open to questions. Thank you for sharing the slide.
Thank you, Johanna. Thank you for Johanna for sharing this very wonderful research and data on re-trafficking in the African region, but also in the on the paper that you have just done and completed. I can see lots of similarities with what Mr. Kasirye has just shared with us. And I think right now we will go into the question and answer phase. We will have Mr. Mtawe come in and help moderate the questions and answers. Mr. Mtawe, are you ready for us? We will share all these materials with you. As Mr. Mtawe comes in, please notify me if you're ready, Mr. Mtawe. Help us take us through the question and answer session. Thank you very much.
Okay, I'm ready, Anna. Thank you so much. I've been trying to see whether we have any questions in the chat box. I don't seem to see. Okay. Because I can see the chat box that the PowerPoint has been shared, that Mr. Kasirye shared earlier on, presented, has been shared to the participants.
There is a question
so
in the Q&A section.
The Q&A, okay. Okay, so we have a question from Alex from Make a Child Smile. We're in the move. He's saying we are on the move doing prevention. Is there anyone who can work with us as we do prevention in the Eastern region? So I think Alex is asking whether there is someone or they can partner with as they do prevention in the Eastern region. He said Eastern region, so it doesn't matter. I think this should be in Uganda. I want to think so.
Can we have maybe Mr. Kasirye or Johanna answer that? Thank you.
I suggest Johanna, because Johanna has been doing that. Maybe Johanna, take over that question.
I don't think I can, because this really is a question for those people who do prevention activities in Uganda. And as you know, I'm based in Kenya. So I think this is for the participants to answer and to self-identify themselves.
Thank you, Johanna. In case you are willing to partner with Alex, Make a Child Smile, to do prevention work in the East African region, please put your contacts in the chat. Or Alex, we will request you to put your contacts in the chat, and then we will have the participants contact you directly on an email or a number that you will have put in the chat. Thank you, Alex. Are there any other questions? Anyone who would want to unmute and make a comment or a question on the topic today, family reunification and reintegration, and also avoiding re-trafficking? Yes, Dennis, I can see Dennis.
Thank you so much, Dennis. Right now, I'm in UAE. I don't know if you are hearing me correctly, because you can hear me well? Okay.
Yes, Dennis, we can hear you well.
Okay, thank you. I've been following since the program started. I just want to pass on just something small that I think it is lacking, so that to enable us achieve this long-term target. I've not seen, especially Uganda, where I come from, I don't see the embassy, our embassies have not been that proactive, or I should say, because the reason why we are not getting even accurate data, like one panelist said, I think the last one, she was talking about lack of enough data. So I think, is it possible to get engaged with our embassies to also do something, maybe put up some special, how can I say it, department to cater for such people, because those that we've identified as trafficked, those are lucky. But there are still so many people there who are still, like here in UAE, you can find so many Ugandans who are, even other nationals, who are stranded. But because their embassies, there's no direct contact, or there's no department that directly engaged in that reason, these people are not heard of. However, I appreciate you guys for the great work you're doing. And I'm sure if we come together, something can be done. Thank you so much.
Thank you, Dennis. Mr. Kasirye or Johanna, do you want to comment on Dennis' submission?
Anna, if I can make a quick comment, already the issue of having the embassies following up on
Thank you, Mr. Kasirye. Johanna, do you want to say something about that? About Dennis's submission on the embassies?
Yeah, I think Rogers has answered this nicely, especially from the Ugandan perspective. Here in Kenya, I know, and I think this is something that also all over the region is taking place, is that the embassies do try to get more into this space by having designated labor attaches in the embassy that should be able to assist these people, also migrant workers that are not necessarily victims of trafficking, but that still see some type of labor exploitation. However, it really is a question of capacity. I hear from the Kenyan context, who do have some labor attaches, which is a great first step, that sometimes they simply don't have the capacity to reach out or to answer all requests. At the same time, there also are many countries in the Middle East that simply, where some of the countries here in the region simply don't have an embassy. One approach that is being discussed at the moment is to have some sort of agreement that if, for example, Uganda has an embassy in one country where there is a lot of labor exploitation and trafficking happening, but Kenya, for example, doesn't, that a Kenyan citizen who would be a victim of trafficking in that country could also go to the Ugandan embassy to receive some initial assistance and then be referred back to Kenya through there, and the other way around, of course. So there are a couple of approaches in that area, but in the end, it really also mostly seems to be a problem of capacity at the moment.
Thank you, Johanna. Mr. Mtawe, I can see some more 3 questions in the question and answer. Do you want to take us through those?
There are more questions we've received from the Q&A chat box. I think we have someone who is nameless, using a galaxy, who's asking what happens if a survivor doesn't agree to reintegration. So that's the question. The other question is, good afternoon. Can I get a presentation for that session? I joined late. That's the comment from Faith Kipsang. I think already the presentation had been shared by Anna. Maybe you can kindly reshare on the chat box so that Faith can be able to have access to the presentation.
Okay.
Either Anna or the host had shared it. Then we have another question here. So say, good afternoon, colleagues. Good afternoon, colleagues. And says thanks for the wonderful presentations. Can we have another opportunity to discuss best practices around successful integration schemes for survivors of trafficking in persons? Any chances of doing longer-term research on the integration of survivors? That is Sarah Kakai from UCAT. And then we have another one from Timothy. Yeah, Timothy is saying that from the research, Johanna, you mentioned that you found out that reintegrated victims of trafficking recon that reintegration programs currently being provided may not be presently sustainable. hence trafficking. What recommendations do you give to mitigate against this? And also another one from Jonathan. Why is the chat deactivated? The chat is okay. It will be working now. Yeah,
Jonathan?
So we can have yeah, we can have responses from Mr. Kasirye and take also some from Johanna.
Okay, I'll respond to one where what happens if a survivor doesn't agree to integration. The survivor has a right to agree to your plan, to your integration or not. Like I said, there are many survivors who have come back to this country because remember, apart from those who go through the normal government channels or probably assisted by OM and other organizations, there are others who come back on their own. Some escape. We've had survivors who escaped from exploiters, assisted to get passport, and they're back in the country, and they're doing very well. By the way, when you go into community awareness and prevention activities, many show up and tell you, me, I was there. But we have also seen survivors who have managed to adjust, adapt, become resilient on their own. So that's an option. You are not supposed to force your plan, your integration, but allow them to do. But if you find one who has adjusted and settled well, can you seek advice or consent to come and help others who are beginning to adjust? Because like we say, this is a holistic intervention, interdisciplinary, requiring everybody to contribute. Now I hand over to Johanna to make observations. Thank you.
Thank you. Also commenting on that question, in principle, there should be 3 different options. There's reintegration, there is integration in the country where the person had originally been found in. There has been one example that one of the CSOs I interviewed for this shared, where they had a victim of trafficking from a country in West Africa that ended up in Kenya. And in Kenya, this trafficking survivor was in a community where she was being exploited, and then had eventually found a contact to the civil society organization and has been assisted. But she actually asked to not be reintegrated into her home community because she already knew, because she had been re-trafficked beforehand, that she would run into problems back in her home community. And she really had left the home community because the situation there was not sustainable for her. So she had asked actively not to be reintegrated. And she then did say that she would be open to moving to Nairobi because there she would be able to get a fresh start. Now, this is one case. In this particular case, the organization helped this trafficking survivor and made it work, and assisted her with sort of setting a foot there. Again, this is a case of one. This is probably not the most representative case, but in this case, the trafficking survivor had a very clear preference. In theory, there also should be the option to move to, say, any additional third country. So in theory, there should be these 3 options. However, in the national referral mechanisms and also in much of our narratives, reintegration really is the default option. So where this doesn't work for trafficking survivors, we seem to be a bit short of alternatives. Answering the other question specifically on which type of recommendations I would give on making this more sustainable. As I had mentioned before, at the moment, what we call long-term seems to be cut at about 6 months. Most organizations seem to monitor their cases for between 3 to 6 months. And previous research has shown that most reintegrated trafficking survivors start running into serious trouble in the 2nd, 3rd year onwards, and that it then becomes more difficult over time. So we need to adjust our timelines here. This also is something basically just a funding thing in the end as well. A lot of reintegration packages are funded only for a couple of months because one also needs to close the case. But since there is some research on the issue, I think that there could be a case being made for these periods being extended. And as I mentioned as well, there should also perhaps be alternatives to reintegration. I can see that on a large scale, this will be this will be difficult work, but it is something that should be considered as an option in some cases as well.
Thank you, Johanna. Thank you, Mr. Kasirye. I'm going to request Mr. Kasirye to have your camera on.
I was going to. Okay, my camera is on. My response was one of the questions which has been raised by Sala Kakai, the coordinator of UKATIP, the network on agencies and civil society addressing trafficking. She was asking, is there a way how we can do further research, we can do more sharing? From Johanna's presentation and mine, this is a new area which has not been actually adequately addressed. And like Johanna is sharing, we need to learn more about what we've been doing, but the challenge would be resources. But like we said, ECPAT France and the people who have assisted us, this area is continuously being documented. And I think the need now, that the fact that we are getting many survivors coming back. Remember, each survivor has a unique experience, I think there are good lessons we can pick from our people and be able to share. So it's an area which we can do further consultation with Johanna and others and see that now that many cases are coming back, Johanna, can we do a bigger region instead of having few case studies here and there? Can we do that? Would be my recommendation. But also, Anna, my closing remarks is I'm grateful for the presentation. I'm grateful for the time. I'm grateful for my colleagues who have been sharing information. And I'm grateful that this is an area which has not been receiving attention. We are addressing. Thank you so much for accepting me to share. Over to you, Anna.
Thank you, Mr. Kasirye. Johanna, do you have any last minute words for? Thank you, Mr. Kasirye. I have taken over.
Thank you so much. Yeah, so once again, it is something where we mostly work with estimates at the number. And again, this research I did in my private capacity sort of over a couple of weekends. There's nothing that stops any of you to do the same if you want to have research on other countries, including Uganda. Personally, I focused on Kenya, Ethiopia, and Somaliland, simply because that was where I got the most respondents. But this is really something where if you do work in this space, it is a bit of a blind spot, and it doesn't have to be. Also in the regional roots mapping that we did, where we asked the question on re-trafficking, many of the participants didn't actually know about whether or not this person had been trafficked before, because it simply wasn't part of their intake interviews. So it also really is something where one just needs to pay attention to include this in the thinking of and the narrative around trafficking. And once again, I also think that it helps to really see reintegration and long-term solutions, not only as reintegration, but also as alternatives to reintegration from a prevention perspective. Because we always talk about, we have so and so many cases of human trafficking in this country. And the important point here is that these are cases of human trafficking. It sometimes could well be that it is the same person having been trafficked several times. And if we really can start focusing on those cases where people are being re-trafficked again and again, then it also could be a very effective way of bringing the numbers down.
Thank you, Johanna. Thank you, Mr. Kasirye. Allow me to thank our key discussants for today in this webinar on family reunification and reintegration and avoiding re-trafficking of survivors of human trafficking. I want to thank everyone who has attended. Thank you very much. Thank you, WFAD, for hosting us and for organizing this webinar on our behalf. Thank you, our panelists. I can't thank you enough. They have reminded us on issues to do with reintegration and what we should do to avoid re-trafficking, but also look at critically doing more research and having more data and evidence on reintegration and supporting survivors of human trafficking, but also dealing with issues of stigma and looking at issues of economic empowerment, but as we also invest a lot in monitoring and then the follow-up of survivors once they are reintegrated back into their communities. Thank you everyone for joining. We are very grateful for everyone who has been part of this webinar. I want to thank UYDEL team. I want to thank WFAD and also thank ECPAT France that has enabled us share this vast knowledge and expertise on good practices in Uganda, in Nigeria, but also across the region. Thank you so much, Johanna and Mr. Kasirye, for sharing that wild experience. Thank you everyone for logging in. Have a good day, and we want to wish you well. We'll continue discussing. Feel free to leave your email and we can contact you and share with you all the materials that have been shared during this workshop. Thank you very much and have a good day. Bye.
Thank you, everyone.